Hi guys, it's Jess. Just wanted to make a couple updates here for people and wanted to touch on one other subject while I'm at it, but we'll just start with the updates. Um, the biggest update is that I started on the first of my medications for my transition on Monday, which is my spironolactone. For those that don't know what that does, at least for transgender purposes, is it basically acts as a testosterone blocker. So I'm still producing testosterone, but the receptors are not able to make use of it. Um, so that's going to have a handful of side effects. It's going to do things like lower my libido. Um, it can actually increase, as a side effect, it can increase breast tissue in men. Um, but more or less, it's just stopping the testosterone from doing its thing. Um, my other two hormone medications are supposed to arrive on Friday, so I'm very excited about that. Um, as a second update, I actually came out to my workplace as transgender. It's not like company wide, like everybody knows, but I spoke directly to my direct supervisor, and she got me a meeting with the head of our HR department, and they both gave me um, a lot of support and encouragement and said, we're going to work with you 100%, mostly just to make sure that you feel comfortable here. And they said if I ever don't feel comfortable for any reason, to make sure that I just talk to them about it. And so it's fantastic. I'm very excited. Sounds like my workplace is going to be encouraging and supportive. Um, the only other real update there is that I've been putting more thought into a name change and what I maybe would change my name to. Um, I haven't settled on anything yet. I'm still just looking for suggestions, advice, opinions, things like that. Um, but I'm putting more thought and effort into it now as things are starting to get rolling. Because I'm still going to be going to work as a male right now. I want to give time for the hormones and everything to kind of do their thing for maybe a couple months. Um, and get more laser hair removal treatments done, things like that before I really start to say, okay, now I'm ready to start going full time. I'm hoping even maybe that if I give it a little bit of time with the hormones and give it, some more months, that maybe my hair will start growing out a bit better, a little thicker. Since it's thinned out so much, I'm kind of hoping, we'll see. Um, I guess if that ends up not working, I can either stick to using wigs or maybe I can even try and see if I can get on something like Propecia or something that'll help facilitate more hair growth. Um, but outside of that, those are really my big updates right now. I just wanted to make a video of, hey, it's only been 2 days since I've been on Spyro, and I'm not even on the hormones yet. So I want to keep making videos to keep updated and keep, not only so I can look back at them, so that people who are maybe going through similar things or who have questions about transitioning can see kind of a timeline of what I've gone through, and I'll explain my experiences as I go. The only thing I can say about the Spyro so far is that, I took the first one Monday after work. I took the next one Tuesday morning before work. I ended up being really queasy and hot and just kind of felt blah for the entire day. Part of that might be just because I took it without food. It does say if you get nauseous to try taking it with food. So today I took it with food. We'll see what happens, I guess. Um, Outside of that, the only other thing I wanted to really talk about is I wanted to at least get some kind of discussion in here and try to help people get some more information. And one of the things I ran into this morning when I woke up was I was looking at Facebook and I was looking at my transgender, one of the transgender support groups I'm in, and somebody had asked the question, hey, are there any more people here that are no op? I feel like I'm the only one. And so, for people who aren't familiar with transitioning and the terms and lingo and stuff that we tend to use, um, there's a couple phrases that get used a lot, which is post-op and pre-op, and that's talking about operation, and that's generally speaking about sexual reassignment surgery. That's getting your bottom surgery. Top surgery would be much less invasive surgery that for females to male transgender people would be getting their breasts removed, and for male to female transgenders it would be getting breast implants. That's usually a lot more affordable. It's not as invasive. A lot more people tend to get those surgeries than the bottom surgery, which is the sexual reassignment surgery. And so when that person said that they were no op, what they meant is that they're not pre-op, they're not post-op, they're just not getting an op. They're not doing it at all. They have no plans to get it done. And a lot of people responded saying, "No, I'm no op. I'm not getting it done." And I'm one of those people that I don't think at any point that I'm going to want to get it done. But I want to take a moment to explain why somebody would not want to get that done. So it's referred to as sexual reassignment surgery, or SRS for short, usually. What that is actually getting your genitals removed and replaced with essentially a facsimile of the other sex's genitals. There's a whole variety of reasons to not get that done. And so I'm just going to go over some of them for you, especially since I get asked that question, and every transgender person gets asked that question. Are you going to get it removed? Are you going to, what are you going to do? First of all, please don't ask that question unless you really know that person and you're really on that level with them, because that's just not an appropriate question to ask anybody. You wouldn't go up to anybody else and ask them about their genitals. Don't ask a transgender person just because they're transgender. I know you're curious. I know you want to know. I know you want more information. That's fine. Make sure that person's comfortable with you and that they're willing to talk about such a thing. Ask them first. Hey, I got a lot of questions about transitioning, and I want to know more about your transition. Would you mind answering some questions that I might have? They'll let you know. And don't get upset or offended if they choose not to answer a question that you ask them, because they're very personal questions. So when it comes to sexual reassignment surgery, there's several reasons to get it, which is that you feel like it's going to help complete you and complete your transition into the sex you're supposed to be. But there's a lot of reasons not to get it. So let's go over some of those real quick. I'll try to keep it as short as I can. So first of all is going to be money. It's incredibly expensive to get sexual reassignment surgery done. We're talking, if not, tens and tens of thousands of dollars, possibly even, $100,000 to get this surgery done. It's an incredibly invasive surgery. It's very detailed. It's very important that you have a surgeon that knows exactly what they're doing and knows what you're looking to get out of that surgery. Because there's so many different things to focus on. Like, they need to know how much sensitivity are you hoping to have? Are you hoping to have sex with those genitals? Are you just looking for something that just looks appropriate? What are you going for? Because that's going to make a big difference as to what they focus on in that surgery. Most insurance companies don't cover it, though some are starting to come around and they're offering coverage. Usually requiring you to live as that gender on hormones for at least a year, if not two, have doctor's recommendations and therapist recommendations and everything else before they'll go ahead and greenlight it. Others don't cover it at all, and some, it depends on your workplace and the coverage they have. Like the insurance company that I have through my work will cover it, but only if the employer has opted for that special coverage included in their plan. So money's a big factor. Number two would be just personal preference. Some people have no desire to get those genitals changed over or whatever because it's not important to them. While they want to become outwardly a woman to everybody that sees them, or outwardly a male to everybody that sees them, the genitals aren't looked at by anybody other than your physician or somebody that you're, intimate with. So it's really kind of unimportant when it comes to the overall experience. For a lot of people, they just like, I don't really need that done. And when you factor in the other factors that come with it, it just doesn't make any sense to bother getting it done. The cost, the surgery, it's, like I said, it's a very invasive surgery. It is a major surgery. They got to put you under for and everything. So, some people are just going to opt out because they don't see a purpose or a reason to go through all that trouble. The For me, the bigger issue beyond money, because I guess there's always a way to come up with money somehow or find the coverage you need somehow if you have that will. But the bigger issue is going to be the complications that come with it. Now, I don't know a lot about female to male transgender bottom surgery, so I can't really speak on that, but I've done a lot of research on male to female because it's something I've looked at throughout my life, trying to figure out what does this entail, what's it all about, how does it work, is it worth doing, why would I want to give up a, a set of functioning genitals for genitals that don't function, and some of that is kind of a misnomer. A lot of people out there um, maybe have watched transgender pornography or something, and so their vision of this male to female transgender woman is going to be a woman that can also penetrate their partner, whether it's a woman or a male. But they can participate in that way and penetrate. And once you start going on hormones and stuff, that's probably not going to happen. The amount of erections you're going to get is severely diminished. You're not going to get them randomly anymore. You may still be able to get them if you get excited enough and aroused enough, but in a lot of cases, you won't be able to get them at all. So you're losing that functionality. You're going to go sterile, so you're losing that functionality. So really, they become not really functional. So that's not even so much a question there as why would I want to switch between functional genitals to non-functional genitals, because they're kind of both aren't going to function right. So the bigger complications come in that when you have gotten that surgery done as a male to female transgender, without going into the gory details of how it works, skipping past that, you end up with, once you have that vaginal canal and everything, you are bound for pretty much the rest of your life to using what they refer to as medical dilators to insert inside yourself to keep your vagina now, to keep that open, because your body treats it as an open wound, just like it would with like a piercing or something like that, and it attempts to repair that. So just like how when you take out your piercings, the hole starts to close up, same thing there. Which means you have to spend, especially right after the surgery, it's usually like 3 times a day for like an hour each time, inserting this thick, rigid plastic thing inside yourself as deep as you can. And the reason for that is because if you don't, it's going to start to close up, and you're going to end up with something even less functioning. And when you've gotten that surgery, chances are you're going to end up with you've got basically a makeshift vagina that doesn't have much depth or width to begin with, and can make having sex with those genitals uncomfortable or painful. And so you have to use these dilators to keep it open and try to constantly insert the dilator further, deeper, wider, etc. And you're talking about doing this immediately after you've had the surgery. So you're talking about basically jamming an object inside of an open wound. It's not a pleasant experience from what I have read and listened to. It's painful. It's very uncomfortable. It's just not something fun at all. And then you have to do that a lot at first and slowly taper off how often you have to do it. But even still, it's incredibly important that you maintain that. And so that means time out of every single day that you have to set aside for that, and just discomfort and unpleasantness that you have to deal with every single day. Um, for me, I don't know that sort of thing would be worth it for me. It's never been about my genitals. It's been about my total appearance and who I am, and how people react to me and how they treat me, I guess. I want to be seen as a woman in my everyday life. What happens behind closed doors with a partner is a completely and totally different discussion. So there, I just wanted to give a couple reasons why people might not choose to do that, for those that aren't really aware, or maybe for people that are considering doing transitioning and they're not sure what they want to do there. And maybe they feel weird because they're like, I don't know if I'd want to get that surgery. I don't know if that's something I would be comfortable with. Does that make me any less of a woman if I don't do that? Am I really a transgender? Is this really what I should be doing? Relax. Not everybody gets that done. Every transgender person is its own unique story, and you're your own individual, and you don't have to do anything that you don't want to do, but it doesn't invalidate who you are or what you are. And it's just really important that everybody understands that, whether you're somebody going through it yourself or you're somebody on the outside looking in. It doesn't change who that person is. It doesn't change the fact that I'm female just because I don't want to get that surgery. It doesn't change that I'm female if I wear men's clothing. It doesn't change the fact that I'm female if I currently look the way I do right now, with my hair a mess and, some stubble growing in. It doesn't change who I am. And it doesn't change who anybody else is if you don't fit that perfect vision of what you want to be. Too much we're seeing a lot of focus played on, Caitlyn Jenner. Oh my God, she's so gorgeous. She looks hotter than other women. It's amazing. Or Laverne Cox, she looks better than so many other women. Or all these other celebrity transgender people who look amazing because they have a team of makeup artists and fashion designers and television crews and everything else doing all this stuff for them. Of course they're going to look amazing, and that's why they're in the media. That's why they're in the spotlight, because they look amazing and they're famous. You're not going to always look like that. Just like how your average man and woman isn't going to look like those stars in movies. You're not going to either. So it's just really important that you accept yourself for who you are. And if other people can't do that in return, then, that's kind of their problem. And maybe there's somebody that you don't need in your life. So anyway, sorry, my videos always end up dragging out longer than they should. I know, but I just thought these couple things were really important to touch on. So I'm going to keep making updates as much as I can as I go through the process. If you're at all interested, just stay tuned. Like, subscribe, whatever makes you happy. I mean, I'm going to keep posting these videos on my Facebook feed and my transgender group, things like that, so that more people can see it. But if you want to make sure that you don't miss any videos or anything like that, then definitely do that. Give a favorite or a like or whatever, or subscribe. Whatever you want to do. I don't care. Until next time, stay true to yourself, love yourself, and don't let the negativity bring you down. Bye-bye.